Okay, so today we're going to do a urinalysis using a reagent strip. If you want to look on page 655 in your workbook, that will help you go along with the process. So we've washed our hands, put on gloves. We're going to check the specimen to see that it's properly labeled. You want to make sure that the patient's name, the date, and the time are on the bottle. If you're going to use a specimen after an hour, then you want to refrigerate it to preserve the specimen. You want to look on your bottle of reagents to make sure they're not expired. And then we're going to swirl the specimen. And then we will use the pipettes. And you're going to put a drop on each pad. Don't blot the test strip, but you can tap it sideways. And then you'll notice they're all wet and they're starting to change colors. So if you look here, it tells you the test and the reading time, what each pad indicates. And then like leukocytes, you would read after 120 seconds, 2 minutes. And then down to glucose, you'll read it in 30 seconds. Sometimes there is a machine you could simply put this strip into, and it would read it for you. But for us, we don't have that. Most of the time, the bottles will have the color indicators for you. I don't happen to have the bottle, but I will also upload this for you in D2L. But this is what you're looking for. So if we look, let's see one that maybe wouldn't be normal. Okay, for this one, it shows that our glucose at the bottom is negative. Everything looks pretty normal on this strip, but if for some reason the leukocytes were positive, that would be indicated if they were starting to turn a little gray or purple. That would show you that there were leukocytes or that there was a presence of infection. So we would need to prepare this specimen to go to the lab to grow a culture with that. So first, we're going to interpret our results and place them on a sheet similar to this. And then we're going to place this, and it has a needle inside of it, so be extra careful when you unwrap these. You'll place the straw inside of your specimen. You're going to take your vacutainer, use your flanges just like when you're drawing blood. And then you're going to push. And the vacuum assists the liquid to flow upwards. Once that stops, you just remove it and you'll label this. And then you will put it in a biohazard bag and you will send that off to the lab. So that's how you do a reagent strip urine test.